So just to introduce myself, my name's Heather Baid, and I'm delighted to have this invitation. It's so nice hearing some Canadian accents, and I'd like to think I still have a Canadian accent, although I do hear from a lot of people from home that say I sound so British now. I've been living in the UK since about 2002, so quite some time. But I'm originally from a little tiny place in southeast BC, and I did my Bachelor of Nursing at UBC and my critical care education at BCIT before moving to the UK a number of years ago. And I've just recently completed a PhD exploring the concept of sustainability in critical care practice. And I had met Fiona Hanley, one of your members, last year, and she somehow put me in touch, which led to this presentation today. So I think we can go forward to the next slide, which are the two aims I set out. So firstly, I thought I would just talk about my PhD research, which is a grounded theory study to explain sustainability as a concept from the perspective of practitioners caring for critically ill patients. And then I thought I would spend the second half of the presentation just discussing some of the organisation and projects in England which are currently working on sustainability initiatives. Some of these you might be aware of, but just in case you weren't, that you might like to contact or look up their reports and case studies to help you with your own work. So moving forward now onto the next couple of slides, there was just a title slide. And then just a very brief overview. My research for the PhD was a qualitative grounded theory study. And I primarily explored two research questions. The first being, how is sustainability constructed by practitioners working in critical care? So in other words, what does that concept actually mean to people? When I did an initial literature review, I couldn't really find a lot written on sustainability from the perspective of critical care practice. And the second was around what are the main processes involved in making sustainability a component of critical care practice. So as a qualitative study, I did in-depth interviews. The sample size was 11, which included 8 nurses, 2 physiotherapists, and 1 technician. And they were all practitioners working in critical care units in what we call the NHS, which is the National Health Service in England. And I used constructivist grounded theory methods for the data collection and analysis. So on to the next slide, which gives an overview of the definition of sustainability that came through from the participants of this study, which really fits with other definitions of sustainability. That in itself wasn't particularly new, it's just it hadn't been written up in critical care literature from this perspective. And ultimately being about sustaining resources for practice into the future so that you're able to sustain all of those types of resources, whether they're physical, clinical supplies, financial, people, time, and knowledge. And moving on to the next slide, there was 3 domains that all of those resources would fall into: social, financial, and environmental. And I thought it's a very brief presentation today, and the remit of your organisation seems to be more on the environmental side, so I would concentrate the discussion on that. I am making these slides available afterwards if anybody wants any of the literature that I reference, including my thesis. So if you wanted some further information on the other side, such as job satisfaction and staff morale, compassion fatigue, all of those types of things, then further details could be found there. So on to the next slide then. The main process that came through was really around decision making. And if you're not familiar with grounded theory research, you take another theory to help explain the data that you've generated for your current study. And I looked at this theory called satisficing. And it comes from a business theory from Simon originally. And the idea of satisficing is that you're satisfied you've reached a goal, but you're sufficing within the limits of the resources that you have, so that you're not then detrimental to the future. And it's a little bit like what a lot of people call the Goldilocks theory of not too much and not too little, but just right. So sustainability becomes part of critical care practice if resources are used in a way which is good enough for safe quality care, but stays within the limits of available resources. I'm not sure how many of you have backgrounds in critical care, but what we do a lot in our practice is actually a lot, and we're very good at doing lots and lots of things. But what we've not always been good at is looking at evidence-based practice. Should the patient have come to intensive care in the first place? And just overall, how are we using resources? And I'm very much speaking from the perspective of English practice because I haven't worked in Canada for a number of years. But currently, there's a lot of fear or worry or stress that's involved with working in a system which those of us who are working in it feel it just simply isn't sustainable for the future. It's not sustainable financially, but equally it's not sustainable from an environmental point of view. And so looking at satisficing as a way of framing the way we make decisions, whether that's decisions at the bid space, decision as a department level, or decision from a hospital and societal level. Another theory that I looked at was one by Hobscawk, which you can see there's 4 concepts on the bottom there: normative, responsible, sustainable, and flourishing. And if you wouldn't mind just going to the next slide. There's further details in this slide, but to summarize, what Hobscawk has done is taken that original concept of satisficing and how we make decisions and proposed that the more we satisfice, the more we'll be reaching what you could say is full sustainability. When I started off the project, I was very much interested in environmental sustainability. For me, it was quite a black and white issue. You're either sustainable or you're not. And the more I interviewed the participants, the more I realized it's a lot more complex than that. And often people be wanting to do things, but not always having the capacity or the opportunity, or perhaps talking about their colleagues that didn't necessarily have the motivation. And the more you satisfice, the more you can move into all 4 of these stages where you have normative, responsible, sustainable, and flourishing practice. So I haven't really got time to go through all of those details, but just to highlight in the responsible row in the middle, doing well while doing less harm. And really that's where I think environmental sustainability and stewardship comes in. So moving into the next slide. Another concept that's built into the satisficing theory is around bounded rationality and looking at the psychology about how we make decisions. Because fundamentally, if we're going to have an environmentally sustainable practice, it's really about behavior change. Behavior change ourselves as individuals, behavior change as a unit, behavior change as the hospital, as the society, the whole country, the whole world, etc. So these were just a flavor of some of the examples that the participants gave me around the things that they felt influenced their decisions about how they use resources, if they use resources, or if they don't use resources. Bounded rationality explains how it's both our cognitive ability as well as our surrounding environment that influences the decisions that we make. For example, our past experiences, the norms and culture that we come from, whether we believe that we can actually make a difference, believing that we can actually be a champion for environmental sustainability, or whether you just simply feel that climate change and the problems around plastic and air pollution, all those things are so big that it somehow disconnects from your daily life as a nurse, wherever you work. In this particular study, it was nurses and physios and technicians that worked in critical care. So I could go on and on about all of those different influences, but just for the sake of time, I think I'll move on to the last concept, which is one around stewardship. So moving into the next slide. And so stewardship being about an altruistic sense of duty to use resources responsibly. And the 4 major themes that were driving what these particular participants talked about, the reasons why they felt they had this sense of duty to do something about sustainability, was they felt they were working in an area which was so resource intensive, but there was very much an imbalanced resource supply and demand. And I imagine that's worldwide around aging population, new technology. When I started working in ICU years ago, people didn't survive as long. We weren't looking at rehab at home. We weren't looking at the same way that we're practicing now. Excessive use of resources, particularly around things like infection prevention policies or daily blood tests or all of those types of things that are just habitual and a routine part of our practice, but not necessarily what we need. And then finally, waste issues around, ultimately there will be physical waste, but the majority of places in England don't have sustainable ways, and in particular environmentally sustainable ways of dealing with that waste. So it was really a concept that helped to kind of package up all of those ideas. And when I asked the participants how they would enact stewarding, patient-centered care came out as a really strong idea around always putting the patient's wishes and no needs first. How many of you are familiar with lean thinking? It comes from the Toyota principles around reducing waste across the entire lifespan of a resource, starting from manufacturing all the way through to disposal at the end, or hopefully recycling, recovering within that cycle. And then the idea of slow healthcare, which you might have heard of. I'm not sure. I hadn't heard of it until I came across it through this project. I heard of the slow food movement. My sister has a restaurant, and years ago she was telling me about her sort of slow food ethos, and there's a lot on that in the food industry. And the idea is that you slow everything down and you do a few things well and have quality over quantity. And ultimately that's more sustainable and more efficient in the long run. So there's one more slide moving forward on stewarding, just capturing that circular economy, as it's often talked about in sustainability literature, around how resources are produced, how they're procured, reducing waste, reusing, recycling, recovering as much as possible. So the final slide from the PhD is just one slide that kind of summarizes the theory around sustainability and critical care ultimately being about the resource that we use, and looking at satisficing as a decision-making framework or way of thinking to define what we mean by quality, then sufficing with the resources that we have, whether that's financial, environmental, or social. Under rationality could be used to look at the influences and how we make those decisions, and trying to foster environmental stewardship to drive people to have a sense of why we would want to be making decisions that are much more sustainable, ultimately having a practice and a community at the end of it that's sustainable for the future. So that's, in a nutshell, the PhD research that I've just completed. And the next slide was just because I mentioned a few references if anybody wanted further information. I'm not sure how many people really want to read a whole 80,000 word thesis, but maybe the executive summary, or I could send you a summary article I've just done, or it's been summarized in this presentation here. And then just in the final part of this webinar today, moving forward to the next few slides, are just around some sharing of different projects and organizations that you might be interested in. So as I mentioned, in England, we call it the NHS, which is the National Health Service, and it has a Sustainable Development Unit, which is actually partnered with Public Health England. And they do a lot of work around environmental sustainability of healthcare practice, but they're also looking at wider issues around air pollution and how climate change affects public health, etc. If you haven't yet checked out their website, I really recommend it. They've got a wide variety of resources, including case studies. The report that I've cut and pasted on the bottom of that slide entitled Sustainable, Resilient, Healthy People and Places, that's the national strategy, which I think is up until 2020, which is quite an ambitious strategy to reduce the carbon footprint of healthcare practice by something like 34%, and then another goal into the future. And their particular carbon hotspots that they're looking at is pharmaceuticals and medical devices, energy, travel and transport, waste, and anesthetic gases. And I have to admit, I'm not up to speed with what the strategic governmental work going on in Canada at the moment, but certainly in England, this is coming from the Department of Health national level around setting very much a top-down approach of a strategic goal setting around changing our practice to have environmental sustainability embedded throughout. And then moving on to the next slide, another organization, if you're not familiar with, is called the Centre for Sustainable Healthcare. It's actually a charity, but they very much work with the NHS and have NHS practitioners working with them. And they have a number of different projects, such as green ward competition. They foster green spaces and NHS forests. They do a lot of education around carbon footprinting and evaluating practice. So if you are making changes to green up your local area, how do you know that you've actually made any difference? That type of thing. Because for those of us that are healthcare practitioners, we're not necessarily experts in carbon footprinting, and so they can provide support in that area. And they have a number of very specific networks. They have a nurse network, one for eyes, dental, psychiatry, respiratory, etc. What's not yet on there is critical care, and they've agreed that we can add a critical care network, which I'm just in the process of helping set up for that. So if you go to their website, you can join it for free, and they have a really fantastic blog website where people quite frequently share case studies, share ideas, you're trying to get something going, not quite sure how to go about it. And I believe there are people from other countries involved in that now, and might have done some work in Canada, I remember seeing at some point. So if you're not familiar with Centre for Sustainable Healthcare, I'd really recommend just joining it for free and then getting their alerts in the particular network that you're interested in. Then on to the next slide. One of the things that the Centre for Sustainable Healthcare have recently done is what's called the SASQ Framework, and they've embedded sustainability into quality improvement. So you might be familiar with the other domains of quality. It's a traditional model that's been around for some time around what defines quality, but they've embedded sustainability into that. Because if you have quality today, but you can't sustain that into the future because you can't provide the batteries or the plastics or all those other environmental issues that we have in the future, then it's not really quality care. So they've written 2 really good articles that I recommend. The first author's Frances Mortimer, and I'll have the web links in the notes section of the slide. I found really useful just for my own practice as well as for planning future research studies in education. So it's quite a good resource. And the next slide is an organisation called Care Without Carbon. And this is a local organisation in Brighton, where I live in the south of England. And they started in the community trust. The trust in England is like an organisation that provides a healthcare service. And I believe they now work with other hospitals in other areas as well, because they've grown so much. And they help clinicians develop green champions, and they have a Dare to Care campaign. They do all sorts of things, and they've saved millions and millions of pounds for their local area, as well as, or while they are saving carbon. So it's very much showing that link between financial sustainability and environmental sustainability. And the next slide is just some initiatives that the Royal College of Nursing is doing. The Royal College of Nursing, or RCN as we call it, is one of the unions here in England, but they also do a lot of professional work. And these 2 particular campaigns have a sustainability component to it. One called Small Changes, Big Differences is helping nurses to become part of the procurement process. And I don't know, maybe that's already happened in Canada, but certainly that's a relatively new thing here in England, where procurement is all about buying stuff. But the people that buy the stuff traditionally have come from the States and aren't necessarily the people that are using things like dressing packs or central line packs or all of those packs that we open and then think, oh, actually, that's not really what I need. And then you go into the clinical skills room, take more stuff out, and the amount of waste that's developed from that. And so they've developed a procurement nursing role, hospitals to and community trusts to set up between nurses and the procurement process. And another big campaign they've done is around gloves and reducing misuse and overuse of gloves and helping hospitals save quite significant financial savings while they're also saving on carbon. So moving on to the next slide. These are 2 documents that have recently come out from the Royal College of Physicians. One about the link between sustainability, climate change, and the National Health Service, and the other document about waste. So I just thought I'd put them out there. If you hadn't yet heard of them, it might be a useful resource. And next one. This was just a selection of a few projects that I was aware of. In England, the anaesthetists have for a long time been kind of leading the way on environmental sustainability issues. And I suspect this work is also going on in Canada around changing anesthetic gases and using anesthetic gases that are more environmentally friendly. But they've also been doing a take-back scheme. Recomed, the other picture showing there is just a particular project or company that's helping hospitals to recycle their oxygen masks, tubing, and other PVC plastics within hospital settings. Asthma or specifically inhalers are another hotspot. If you sort of take all of the carbon footprint of the UK, and I imagine Canada's similar, and then you take where does most of that come from? Pharmaceuticals comes out really high, and within that inhalers come out really high. And in England, they've not been using dry powder inhalers that frequently, and so the guidance has come out to change prescribing and look at using different types of inhalers that have a significantly lower carbon footprint. Also also a local project here in Brighton where pharmacists were asking patients to bring their inhalers back, and the majority of patients either had more than half full or they were completely full when their inhaler was being re-prescribed. The first thought is they're not getting their medication, but the second thought is what waste and the amount of plastic that was being used and not being recycled, etc. So there was a big local project looking at inhaler use. If anybody's interested in that, I can send them further information. Finally, the British Thoracic Society has put out a recent position statement around environment and lung health. And the healthcare professionals involved in that society are working at quite a national level, advocating with the government and other organizations around air pollution. Last year, plastics seemed to be the big thing on the agenda. This year, it all seems to be a lot of talk about air pollution. And they've also put out some guidance around how healthcare practitioners can think in an environmentally friendly way while they're prescribing or administering and dealing with treatments in relation to respiratory conditions. And then on to the next slide. I suspect the majority, if not all of you, might be familiar with the Nurse SASQ Toolkit, but I just put it here just in case. Because when I first met Fiona Hanley, it was actually at a workshop of the person that helped to set up Nurse SASQ. So just in case you aren't familiar with it, it's a free resource that's available in a number of different languages, including English and French. And you just go to the website and you join, and then you can access all of the resources for free. So if you're looking at trying to do some green championing in your local healthcare setting, or you're an educator and wanting to embed sustainability into your curriculum, it's a really fantastic We've got loads of videos and PowerPoints and all sorts of different educational materials that are there for free. And then on to this, or second to last slide. This is more about ethical procurement, but I just thought I'd mention it if it was that interest, because I think environmental sustainability and social sustainability, in particularly fair trade, are so intrinsically linked. And I recognize that everybody can see the picture, but for those who can, if you weren't aware, the majority of the world's metal supplies for healthcare instruments, as well as gloves, come from conditions such as the situation that you're looking at, where there's child labor, there's unsafe labor conditions, and it's routine for people to lose limbs and lose lives for making those materials under the pretense that those materials are then being used to have healthcare in another part of the world. So the British Medical Association and Medical Fair and Ethical Trade Group are advocating for changing that. And in England, a lot of the people that are into environmental sustainability are very interested in this, what they're calling fair medical trade as well. So I put a link there if anybody was interested. And finally, the last slide, at the University of Brighton, we have a sustainability special interest group, and we have a website that you can see on the bottom there. And we have an annual conference every year where we record all of our oral presentations, all of the posters, abstracts, everything's freely open source online. So if you wanted, you could go to that website and access any of the conferences that we've had. We also have other examples of how we've embedded sustainability into the curriculum of our courses here in the University of Brighton. So the last slide is just simply to say thank you and hope that was useful. I don't know if maybe some of it you're familiar with already, but also an open invitation. I would love to hear from all of you about what's happening in Canada, and I'm looking at some post-PhD research specifically for sustainability in critical care, leading on from the grounded theory research. And so if you're interested in finding out more, or perhaps collaborating in the future, joining our critical care sustainability network, please do be in touch, and I'd love to hear from you. So thank you very much. I don't know if there's any.
Right, and oh, thank you, Heather. This is Jessica here, moderator, and what a wonderful presentation. Such a great opportunity to get a taste of this work. Are there any questions for Heather? We'll open it up for a few minutes.
Hi, Heather.
Hi.
Hi, this is Helen phoning from Comox on Vancouver Island.
Oh, I know Comox very well, yes.
Oh, great. I have a group here that's called Comox Valley Nurses for Health and the Environment. And we just had our meeting this week. And interestingly enough, my background is critical care. So I worked in ICU and emergency rooms for years. And
yeah.
can appreciate all the waste that goes on and such. And one of the students is actually wanting to start a group at a new hospital that's just opened here at the river. And so I just wanted to say how much I appreciated your presentation, as well as all the resources, because here, you know, she's just new at this. She wants to take this on because she's a bedside nurse in med-surg.
Yeah.
And so thank you. This will be very, very helpful, and I'll pass that on to her.
Oh, that's fantastic. And I remember I used to always feel like I was the only person. And in fact, when I did my master's years ago, I wanted to look at this topic, and I just got completely laughed at. And because at that time, climate change wasn't on the national news. It was just a different era, at least here in England. And I just felt like I was the only person, and I didn't even know where to start. And then over the years, the more and more you talk with people, there's actually a lot of people out there, but often it's just about trying to find where to channel that energy. And some of it's around expertise, because we're not environmental scientists at the end of the day.
Absolutely. And in fact,
in your local hospital, you can't recycle, or you'd like to, or you think it's happening, but actually there aren't the facilities locally to take those things forward. And recycling it at the tail end is actually, in a way, it's a drop in the bucket. It's about that massive behavior change starting from, you know, that beginning part of that life cycle.
And exactly, that one of the nurses that wants to be involved is a home and community care nurse. And and there again, you know, she said, this is all, we've all gone to disposable, and even the patients are complaining about how they see that at the end of her wound care that she's done there, how much garbage there is that's been produced. Anyway, thank you, really appreciate it.
And it is tricky, because it's the same in our home lives. You know, you switch from one thing, you switch from plastic to paper, or you switch from this to, you know, everything on technology. But where does that technology come from? How is it produced? Like, you know, what a lot of people are doing is looking at the entire life cycle, because there can be knee-jerk reactions.
Correct.
And so, and fundamentally, cost does come into it. It's cheaper to throw something out than it is to pay somebody to re-clean it.
And that is the argument.
A holistic systems approach to look at the bigger picture, rather than a whole bunch of knee-jerk reactions that aren't sustainable in themselves in the long term.
I agree. Yep.
Yeah.
Thank you.
Thank you. And do pass on my details, and anybody to be in touch. I would love to hear from them and hear their stories or share ideas.
Super. Thank you.
Excellent. And do we have any other questions for Heather? Or any comments for that matter? And Jessica, your moderator here, I just wanted to also say, Heather, thank you so much for specifically noting that there was a time for you too where this topic wasn't really as in the forefront as it is today. And it's just, it's so great to hear from another person who has been engaged in this for a while now and remembers a time where these issues weren't as widely recognized, and can note the progress forward, and that has been a part of that progress forward. So thank you.
No, thank you. And I hope I haven't spoken so quickly. I think I was so excited to have all this contact with Canada, because I don't often get to meet Canadians here. It was such a fantastic opportunity. So I was quite excited to do that. And I made a note to myself to speak too quickly on a webinar. So apologies, I went a bit too fast. But
yeah, and we're really grateful that you're willing to share your slides with us and all of the resources that you've highlighted for us. Maybe a question for you that's kind of on my mind, Heather, and I'll do my best to articulate it. I guess given the expanse of these kinds of issues, as I'm sure you're aware of, if you were to be having like the 5-minute elevator conversation with a new grad, for example, that is like, yeah, I'm interested in what you're talking about, what would be kind of the key things that you would highlight for that person?
I think the first part is just that recognition that if they have ideas, they're really valued. And actually, if you're a new grad, you have such a fresh perspective on things, and to really encourage that person to voice their ideas, and that they're just as much of an expert often as the most senior person in a unit when it comes to this kind of topic. In fact, in some ways, they might be more of an expert depending on their backgrounds and things. And to just really encourage them to to champion and to be a leader. There's no reason why somebody really as a novice to the unit can't be a leader in sustainability if it's something that hasn't been addressed before. And also to look at sustainability, people on the involved, but to really connect in with the departments like estates, also to their senior managers and executives in whatever kind of organization they work with. Because from my experience is that if you have green champions doing the work on a daily basis, but you haven't got that top-down approach, often you really struggle and you feel like you're banging your head against the wall. If it's so much of a top-down and you feel like it's just people telling you what to do, that's not going to work. And you kind of need that perfect balance where you've got a bit of both, and to just really encourage them to look out for that and try to encourage that as much as possible. Did I answer?
Wonderful. Yeah, that's great. Thank you, Heather. Any other questions or comments for Heather?
This is Fiona speaking, and hi, Heather.
Hi, Fiona.
I just wanted to really thank you for the fantastic presentation, and also just to say that I think it's really great to have this connection with you and with the UK. Because we tend to connect, I guess, more with the States, but there's so much going on in the UK, and I think it's very encouraging to hear about all of these initiatives. I think our systems mirror each other quite well, I really hope that we can keep up this connection and learn from your expertise and learn about some of the other things that are going on in the UK, so that we can help advance things here as well too. Because I absolutely agree with what you said, that all of us have been working in little silos in the past, and all of us, I think, have felt very isolated. And so being able to share that expertise and knowing about what works is really, really important in being able to move ahead. So thank you.
And that's something as I said earlier, I really found made a difference, particularly networking in with blogs through the Centre for Sustainable Healthcare. And I mean, I'm now sort of going to, there seems to be a lot of events happening in where you often meet the same people, but what's cool about that is actually we're developing a sense of a peer community and supporting each other and sharing ideas, and this really worked. So yeah, and I'd love to stay connected. And on the education side of things, for anybody out there who's working in university settings, my main job is teaching an intensive care course, which is for post-registration nurses. So it would be sort of equivalent to the course that I took at BCIT for students that are already nurses, but then specializing in intensive care. But I've got colleagues who obviously teach on the post-registration BSc nursing course, and we're all looking at ways of how we can embed sustainability throughout, so that nurses for the future are coming out. Because actually the students come in wanting to do things. They're the generations of had a different upbringing than a lot of us have had, and hearing the student feedback is that they're quite frustrated that when they go into hospital settings or even within our university environments, they're not able to act in an environmentally sustainable way, and they'd very much like to be part of that change. So yeah, I would love to hear both from the clinical practice side as well as the kind of education for sustainable development side.
That's great. We'd love that too.
Excellent. Thank you for the question and comment, Fiona. And just given the time, because we did get to a bit of a late start, unless there are any burning questions for Heather, and of course, I'm sure there's the opportunity to submit questions to Heather if something does come up later. But yeah, any last burning questions or comments for Heather? Okay.
Could I just say a final thank you? And please do share the slides. And I might have mentioned it earlier, but sections of the PowerPoint are web links for organizations and reports and documentation that I talked about. So hopefully it's all obvious there. Otherwise, please email, tweet, I'm on Twitter, or be in touch, and love to hear from everybody.
Excellent. Thank you so much, Heather. That's great. And we definitely look forward to continuing our conversations with you and working together on these. Thank you so much. That's a great way to set the tone for our AGM. So